Hello, I'm Dr. Kerry Kaufman. I'm on the clinical faculty at the University of Washington and the medical director of the Bellingham Breast Center. In evaluating the breast patient, we use a three-pronged approach: the clinical breast exam, mammography, and ultrasound. Documentation of mammography is very well established. Documentation of ultrasound is established. But the clinical breast exam has not been documented well until now. The SureTouch visual mapping system accurately documents the clinical breast exam. The real-time image of that palpation exam is seen on the monitor. So the visual mapping system allows us to solve the problem of inconsistent clinical exams between one examiner and another. This gives us a reliable, repeatable, and objective record of the clinical breast exam. So how does it do that? Using a probe that has tactile sensors on it, the device translates the clinical exam, the palpation of the breast, to an objective record. For example, the clinical breast exam is the most accessible method to examine the breast. The problem has been that one clinician examines the breast and describes the texture of the breast as firm, fibrous area, while another clinician describes the breast as being dense and thick. How do we relate those two? Is it the same exam or is it different? The SureTouch visual mapping system gives a permanent, repeatable, reliable record of that exam among different clinicians and among different days of the week or months of the year. This training video is separated into two parts. In part one, we'll use the SureTouch visual mapping system to examine patients in our clinical section. And in part two, we'll have our engineer explain the SureTouch visual mapping system in much more detail. To further explore the SureTouch system and explore the warnings and details, please refer to the user's manual. This training video serves as a supplement to that document. Please note, the FDA has approved the SureTouch system for documentation purposes only. The SureTouch system should not be used as a substitute for clinical breast exam, mammography, ultrasound, or breast biopsy.